and public health experts are calling on the government and the Ministry of Health to prioritize the public health impacts of illegal mining, commonly known as Galamsey. They urge the adoption of a research-based approach to fully understand the health and environmental consequences of these mining activities. More in this report by our correspondent in the Eastern region, Neo Ni Amate Kanaku.
In recent weeks, various religious and professional groups have joined the fight against illegal mining known as Galamsey. Some have even gone as far as calling for a temporary ban on all forms of small-scale mining. However, this proposal has been met with opposition from the Deputy Minister of Lands and Natural Resources, George Merikuduka, and the leadership of the Ghana National Association of Small-Scale Miners. They argue that such a ban will severely impact licensed small-scale miners who are not involved in illegal operations in forest reserves or water bodies. Public health professionals, alarmed by the environmental destruction and water contamination caused by Galamsey, are now emphasizing the urgent need for government to address the issue from a health perspective. They argue that tackling the root cause of Galamsey and building the capacity of public health professionals to address its related health concerns could rally public support for efforts to end the illegal mining crisis. One such expert is Professor Daniel Anson, former Dean of Medical Science at Kwame Nkrumah University of Science and Technology and current board member of Ensign Global College in Bonn. Speaking at the 10th anniversary launch of Ensign Global College, Professor Anson, a pediatrician, highlighted the severe health risk posed by heavy metal exposure from Galamsey activities. He stressed the need for enhanced training for public health professionals to combat these health dangers effectively.
There is a need for us to have a public health agenda on the Galamsey or the illegal mining issues, to look at all the dimensions of its impact on public health. And therefore, any call to look at this impact on health is very important. The Ensign Global College is looking into having programs that look into public health professionals who can conduct research into mining and mining activities. And so I think it's a good call for academia to be interested in what is happening.
The president of Ensign Global College, Professor Stephen Alder, echoed these sentiments. He called for a holistic approach to the Galamsey crisis, one that addresses its root causes and generates sustainable solutions.
There's the issue of why are people doing it in the first place, the employment issue. There's the repercussions of this type of work when chemicals and other pollutants get in the waterways and we start to run into health issues that are a ripple effect from this type of activity. And so it's very difficult to look at just one slice of this and think that we're going to come up with effective solutions. So in public health, we look at the whole, we look at the picture, we try to look at the entirety from the individuals involved to all of the ripple effects, both the environment, the economy, the what it does to our society and how it reflects on the development of the country.
As part of its contribution to addressing the public health challenges posed by Galamsey, Ensign Global College is introducing innovative academic programs designed to equip public health professionals with the skills needed to tackle these emerging issues. The newly matriculated students are eager to engage in research that could yield solutions to end the Galamsey menace.
It's an area that is bordering the country because as we can all see how much it's affecting our water bodies, we see that destroying the water bodies would affect us eventually. It's starting from those areas, but then we'll get to see it in some few years' time, how much it will affect us. There's a need to intensify some public health policies and then law enforcement. The policies are there, but now I think that is the enforcement of the laws that is much more of a problem.
Once the chemicals affect the water or that we drink, definitely people will have some aspect of it affecting the eye. Yes, and it's an area that we want to do a research or look at greatly after as part of our thesis or our research. Yes.
Public health experts are calling on government to ensure that this issue of Galamsey and its menace is treated like a public situation. According to them, they are ever ready to collaborate with government to ensure that the menace of Galamsey is really addressed to save our water bodies and the environment. For Channel One News, Nil Ni Amati Kanaku.